Hey everyone, I'm Dr. Camille, and today I'm going to be talking about hormones. This is a talk I gave to a group at a medical spa who was interested in learning more about hormones, and I just love bioidentical hormones. And so today I'm going to kind of just tell you about myself and tell you about hormones. Here we go. So this is just kind of an overview of myself. I was a Navy physician for many years. I've gone full circle and I'm working back with the military population still. I'm a board certified ER doctor. I've been working in the ER for over a decade, and I'm also board certified as an anti-aging and regenerative medicine doctor, which is my new favorite thing to do and talk about. I'm also a certified headache specialist through the National Headache Foundation, as I'm kind of what got me into all of this functional medicine is my long journey with trying to heal myself of my chronic daily migraines, and hormones were a big part of that, bioidentical hormones. I'm also certified in aesthetics, and I specialize in bioidentical hormones, including thyroid and also gut health. Super important. So here's just me back in the day. I did 2 deployments on this ship with the U.S. Navy as the Navy doctor on this ship. I also was kind of a high-flying ER doctor for many years. Here I was featured in a local magazine at one of the ERs I was staffing. But when all of that was going on, I was riding high, and then my world imploded. And I went through a really significant health crisis where here I was working in the ER. I had just had my first child, and I was rocked with infertility, lost a pregnancy, couldn't get pregnant. I had extreme fatigue and tiredness. I mean, no matter how much I slept, I got out of bed just feeling totally exhausted. I had no energy. I had unrefreshing sleep. This is when I really struggled with migraine the most. I had a daily migraine for 5 years straight. Yes, I said that right. It was really bad. And then I got into depression. I mean, I was miserable. I couldn't smile. I was overwhelmed. I was irritable. I started having anxiety and panic attacks for the first time in my life, and that's when I truly hit rock bottom. And then I was, new enough to say something is going on with my hormones. I just had that sense. And luckily for me, I kind of saw the light. I sought out a functional medicine practitioner at the time who identified that I had a lack of hormones and put me on some bioidentical hormone replacement. And then essentially I got my life back, right? I went back to the ER. I ended up having 2 more children. Migraines improved significantly. And then I just said, this is the path for me. I want to help people. I want to heal people. I don't want to be stuck in the, medical paradigm where we're band-aiding symptoms, but we're not healing anyone. So what are hormones? So we think of them, hormones in general are chemical messengers. They tell our body what to do. We know that they exist, and we think about, especially for women, reproductive health. And so in women, estrogen and progesterone regulate the menstrual cycle, and they also support the uterus and the fetus during pregnancy. And I always put this here, women need testosterone too. So it turns out in my particular crisis, I had undetectable levels of testosterone, and that's because of an intimate relationship between chronic stress and the adrenal glands and your hormones. But so women need testosterone too. We can't neglect that. We can't think it's just all estrogen and progesterone. And again, we think of hormones as just, our menstrual cycle or reproductive health, but there's so many other functions. So they regulate mood, they strengthen our bones and prevent osteoporosis, they help us with muscle strength and stamina, protection of our cardiovascular system. That's why we know that when women hit menopause, generally their risk of cardiovascular risk really skyrockets. Hormones are neuroprotective. They help with our memory. They help protect against Alzheimer's and dementia. That's one of the ways that they're really helpful with migraine attacks as well, because of the neuroprotective benefits. They help us with a healthy metabolism, weight control, insulin resistance, overall give us energy, a feeling of well-being. Of course, they can help with our libido. And then, there's lots of studies that show that just overall hormone replacement decreases our morbidity and mortality. So lots of functions. So what would be some symptoms that you might be having a hormone deficiency? Some of them I mentioned kind of what I was going through. Sometimes it's feeling exhausted. Maybe you're not sleeping well. I see this, women in their 40s often start showing up in my clinic because suddenly they're awake at 2 a.m. every night. Or you're sleeping, but it's unrefreshing. You're waking up exhausted. Maybe you're gaining weight, especially around your abdomen. We see this generally getting past menopause is where you'll really start to see this. Sometimes depression and anxiety, that again, the women in their 40s and that perimenopause, before you hit menopause, your hormones, especially your progesterone, are decreasing and you might feel extremely irritable. You have trouble sleeping. You might feel anxious. This is when a lot of people are kind of offered a, antidepressant by their doctors. But it's really their hormones that need to be addressed. And that feeling of overwhelm, maybe you can't handle stress as well as you once were. And then as you move more into a true menopause, it's that tearfulness, weepiness, can't control your emotions, sadness, those kinds of things, as well as hot flashes, etc. Now, in the younger women, they can have hormone deficiencies too. A lot of times this manifests as when your progesterone is low, then you are estrogen dominant. And that can give you symptoms like really, really heavy, painful periods. Your periods are irregular or heavy or lasting too long. You can start to get fibroids in your uterus, severe PMS, and then we can see infertility, decreased libido, and more. Okay, so young women often can benefit from some bioidentical hormone replacement too. Instead, what often happens in mainstream medicine is that they just get put on, birth control, which often doesn't really control the symptoms and sometimes just makes them feel worse because those are synthetic hormones. Okay, so then you might be asking yourself, well, if hormones are so important, then why doesn't my doctor give them to me? Well, this is a really kind of complex answer, but what happened back in the early 2000s is that a landmark study came out, and what they did is they took older women, postmenopausal women over 65, often with multiple comorbidities and cardiovascular disease, and they said, well, we know that estrogen replacement and things like that are important for women because it protects their bones and their heart and their brain. So let's see if it's safe to do so. But what they did was that they used really, really high supraphysiologic doses of not bioidentical estrogen, but conjugated equine estrogens, okay? And they mixed them with a fake progestin, medroxyprogesterone. And when they did this, what they found is that women were getting breast cancer more often. And so what they did is they actually stopped the study. They said, hormones are dangerous, stop the study, basically don't give them to anyone, and mainstream medicine kind of turned their back on hormone replacement altogether. When I was going through medical school, I don't really remember learning much about hormones, if anything. I mean, maybe the basics, but certainly not about replacement or how important they are. And it was largely because of this study. And so, nowadays, for in extreme cases, like young women who've had hysterectomies and such, they'll still give them some estrogens. But in general, the mainstream medicine has really turned its back on hormone replacement because of this study. But it's really important to understand, they were not using bioidentical hormones. They were using conjugated equine estrogens. That means they were taking pregnant horses, getting their urine, and extracting estrogen from that. And then they're also making fake synthetic progestins that do not look like what's in your body. And these have been associated with negative health impacts like breast cancer in women, okay? So that's why your doctor's not talking about hormones to you. Now, it's really important to make this distinction. When we talk about hormones, I am specifically talking about bioidentical hormones. And what that means is that these are not synthetic hormones from the pharmaceutical industry. These are hormones that are manufactured and made in a compounding pharmacy that look exactly physiologically to what's in your body. And when your body sees these physiologic normal doses of hormones, it responds well. Okay, so they can actually mitigate all of the risks that we talked about from low hormones. Like, we can protect the bones, we can protect the brain, we can protect the cardiovascular system, and more importantly, some women just have terrible symptoms. I mean, like we talked about, the insomnia, the anxiety, the irritability. So they protect against that as well. So then I'm just going to go through a couple studies. I mean, there's tons and tons of studies, but this is just showing you that, again, when we're talking about bioidentical hormone replacement therapy, we are not talking about the same hormones that you've heard these scary tales about. Okay, so for instance, when we're talking about natural progesterone, that which looks like what's in your body, there are favorable actions on vessels in the brain. Okay, and then it's contrasting. This is not true for synthetic progesterones. Recent trials have indicated the association of natural progesterone with estrogen confers no risk of breast cancer, as opposed to the use of other synthetic progestins. Okay, so we're seeing benefits from these in a different profile than what was seen in that Women's Health Initiative study. Here's another one, the bioidentical hormone debate. Okay, so bioidentical hormones have some distinctly different, potentially opposite physiological effects compared with their synthetic counterparts, which have different chemical structures. Okay, so we're talking about apples and oranges here, guys. We're talking about something that you're replacing because your body's low in it and it looks just like what your body needs, versus, some oranges that are, totally different, that you're feeding your body and your body responds accordingly. Okay, both physiological and clinical data have indicated that progesterone is associated with a diminished risk for breast cancer compared with the increased risk associated with synthetic progestins, those which, would be found in birth control pills. And bioidentical hormones are associated with lower risks, including the risk of breast cancer and cardiovascular disease, and are more efficacious than their synthetic and animal-derived counterparts. Okay, so progesterone. I love progesterone. This is really the first hormone that most women need. We talked about young women often need progesterone because they are estrogen dominant, and that's causing a lot of that. PMS, PCOS, endometriosis, and then as women get into their 40s, they get into this perimenopausal state, which is where progesterone is dropping like a rock, but their estrogen is not dropping. So roughly from the time you are 40 to the time you are 50, you are in perimenopause, your progesterone has dropped, your estrogen has stayed the same, and so you are in an estrogen dominant state. Okay, progesterone is produced by women's ovaries. Of course, it's helpful in the menstrual cycle, prepares the uterus for implantation. Males also have progesterone, and it facilitates sperm and androgen synthesis. It also is really important for their nervous system like ours, and can impact sleep if they're low in that. So other functions of progesterone. So this is really, again, where I was kind of going when women are in their perimenopause years. A lot of times it's this irritability. I can't handle my stress. I'm not sleeping well. I feel anxious. And that's because progesterone is a really powerful modulator of GABA. And GABA is the only calming neurotransmitter that we have. So it's really important. And so if we don't have progesterone, then we're losing that ability to make that, that calming hormone. It's really important for deep and restful sleep. It helps us burn fat. It stabilizes blood sugar so that we don't get insulin resistance. It's very anti-inflammatory, and this is one of the reasons why it's so neuroprotective and really important for migraine health, because we know that migraines definitely have a inflammatory component to them. It stabilizes estrogen levels, and this just cannot be understated because, again, we never want to be estrogen dominant. If you think about most breast cancers, they are estrogen sensitive. And so if you are just full of estrogen with nothing counteracting it, like progesterone, then you're setting yourself up for some increased risks of cancers there. it supports the nervous system. In some countries, in some European countries, actually, when people have strokes and they go to the ICU, they are treated with high dose IV progesterone. That is because it is so neuroprotective. And then I put here again, it helps prevent breast cancer, which we'll delve into a little bit more. Okay, so symptoms of low progesterone, I've kind of already touched on this, but people waking up at 2 a.m. every night, that's a big one. Kind of gaining that abdominal weight, and that's more because of the estrogen dominant effects. Feeling overwhelmed, depressed, or anxious. Sometimes cognitive effects, like you're not thinking as clearly, you can't concentrate, you're more forgetful. Definitely migraine headaches. We will see women, again, particularly in that perimenopause age, where they will just suddenly start having, terrible headaches or terrible migraines, or maybe they used to have them, but never to this degree. And it's that can really be improved by just starting some bioidentical progesterone. And then, particularly in the younger women, we see those irregular heavy menses. Also, I see this a lot in the perimenopausal women. It's so unfortunate, but it's almost would be expected that, as again, in those perimenopause years, you're estrogen dominant, which is causing proliferation of your uterus, and you start bleeding more heavily. And instead of getting anyone progesterone, the treatment is a hysterectomy, which, they tell you, well, you don't really need your uterus anymore. That may be true, but all surgeries have risks, and if it could be mitigated and you could avoid that surgery just by taking some progesterone, that seems like a better option. So this is a really important graph. So you can see estrogen is in blue and progesterone is in red. And what it's showing you is that after the age of, 40 roughly, both hormones are sort of dropping, but the progesterone is dropping much quicker. So you can see that by the time you're, 45 to 50, you have considerably more estrogen than you do have progesterone. So that's where, and that's what it's showing. It says there at menopause, there's a much higher estrogen content compared to progesterone. And that's really important because, again, as I mentioned, we know that most breast cancers are estrogen sensitive. And look at the peak here of breast cancer diagnosis. Right around the age between 40 and 45, this is the most common time that breast cancer is diagnosed. Here's another one. Between the age of 40 and 49, you see that breast cancer diagnosis just really spikes up. And again, what you're seeing, so what's happening between the ages of 40 and 50, you're seeing that estrogen stays high, progesterone is low, and they put on here the risk period. So I'm not going to say that all breast cancers are caused because of this, but what I would say is that there seems to be some, commonalities here is that women are very estrogen dominant during this time, and this also happens to be the most significant time period of when breast cancer is diagnosed. And so there is some evidence that if we prevented that estrogen dominance, if we supported the progesterone levels and gave bioidentical progesterone, there might be significantly less breast cancer diagnoses. And this is just some statistics on breast cancer, but the American Cancer Society estimates that for breast cancer in the U.S., for last year, there was about almost 300,000 new cases of breast cancer diagnosed in women. Almost 43,000 women will die from breast cancer. So breast cancer is the second leading cause of cancer death in women. So again, what would happen if we gave people bioidentical progesterone and prevented that estrogen dominance? There are some small studies on that look favorable. Okay, so again, I love progesterone replacement. I have seen lives change, and I'm not kidding you. Literally 180-degree change in women. So the biggest reason why I love it is that women feel so much better. So if you're in your 40s and you're feeling any of those symptoms, can't sleep, feel anxious, feel irritable, any of that kind of stuff, you will feel so much better with some bioidentical progesterone replacement. Typically, I like to give this orally. Again, from a compounding pharmacy, that's because of the way it's metabolized. It will then go on to trigger GABA, that calming neurotransmitter. Helps with improved, deeper, more refreshing sleep. And it also can be used topically, which is nice because this one is over the counter. And I especially like to use it topically in younger or menstruating women. Okay, so let's move on to testosterone. Again, I love this one because this one personally changed my life. I was, in a crisis, rock bottom, and taking testosterone really significantly helped me. So in women, testosterone is primarily made in the ovaries, but also the adrenal glands, and that's where that really intimate relationship between stress, adrenals, and your hormones come in. Of course, we know it's important for muscle mass, bone density, cardiovascular health, but it's really, really important for energy health. So again, some women will kind of show up with symptoms more like exhaustion, lack of motivation, lack of drive, lack of stamina. Maybe they don't have enough energy to work out, or if they do have enough energy to work out, it's like they don't have the stamina to get through their workouts like they once did. It's also really, really important for mood and the nervous system. So you can see a lot of anxiety. I see men and women with pretty significant anxiety when they don't have testosterone. So like most hormones, we can see here that, our testosterone is declining with age, so that you can see by the time you're, 40, you have maybe half or less of what you had when you were younger. So symptoms that you might be experiencing as a woman with low testosterone would be just that really exhausting. I remember during my crisis, there was almost a year where I would sleep 10 plus hours every night, and the first thought that went through my mind every morning was, I'm so tired. So I never want to feel like that again. Now I wake up, I feel great, I have energy. So that unrefreshing sleep, loss of stamina, loss of drive, and that's really important. It's not just, loss of drive to work out. No, I mean, this is like people who are running companies, running families, have real lives and jobs, and it's like they just don't have the energy, the motivation to do anything. I had a patient come to me saying, I can barely get through my day. I have no motivation to do anything I once used to love at all. And that's sad. We want to give people that energy and that vitality. Again, you can see significant anxiety, severe migraine headaches, infertility. And so that was what was going on in my case. I was having infertility issues. Once I got my testosterone fixed, I actually conceived easily and naturally at the age of 40. Loss of muscle mass, difficulty losing weight, loss of strength and muscle tone, trouble sleeping, and I put a little libido in there, and it is true, but I always put it at the bottom of the list because there's so many other things that go along with testosterone and hormones other than libido. Okay, we're going to talk about men a little bit, and so, people know about testosterone replacement in men for the most part, I think. I think it's getting more common, but I also think that people think that it's just kind of like a vanity hormone, like, oh, it's only for people who, want to get buff or want to work out more. And it really couldn't be further from the truth. So here's just another pictogram. You're seeing that testosterone is dropping significantly. So by the time you're 50, it's half of what it was when you were 20. And then as you get older, it just drops more and more. So, we call, we all know what menopause is when, women's hormones drop, and men go through a phase of when their hormones drop to roughly around the age of 45 to 50, and that can be called andropause. But during that time, it's mainly for them, it's their testosterone dropping, and, they can feel like, okay, I'm losing muscle mass, or when I'm working out, I'm not getting any gains in the gym. But also, you see those men with like the big bellies, that is loss of testosterone, but also some aromatization going on that's causing high estrogen levels. So when I see a man with a big belly like that, I'm thinking of really high estrogen levels, which is bad because even men, we don't want high estrogen levels in. But you can see a lot of cognitive issues, difficulty concentrating, forgetfulness, You can see depression, anxiety for sure, decreased drive and motivation, which again, this is a big deal. I mean, these people are working, they're running businesses. You need to have your drive and motivation. Low energy, just an overall sense of poor well-being. You can see people get really irritable, same with women. So it's that irritability where it's just they can be hard to be around. Maybe they don't want to be around themselves. Insomnia, decreased libido, and some erectile dysfunction. So here's, I like this pictogram. It kind of just shows the difference between the two. If you have optimal testosterone levels, you're going to have a sharper mind, you're confident, you're able to put on muscle, you have a better mood, you're happy, your heart is healthier, you have plenty of energy and strong bones. And so the way I see it is, sure, it might help your physique, but you can see how this is so much more than physique, right? I mean, look at the guy on the right. He has no energy. He's miserable. He's depressed. He's anxious. He's irritable. Plus, he has some increased health issues. He's having increased risk of cardiovascular disease, bone loss, all these things. So I look at testosterone replacement in men as truly medically necessary, not just a vanity hormone. Okay, so it's not just a vanity hormone. There's lots and lots of studies and data that show specifically for testosterone replacement in men that it is an independent risk factor when you are low in testosterone for increased morbidity and mortality. There is so many studies showing that. So being low in testosterone increases your risk of death. Fact. Okay. You can see elevated cholesterol, you can see an increased risk of cardiovascular disease, and an increased risk of diabetes and metabolic syndrome, bone loss, osteoporosis, sleep problems, and lots of good evidence showing that all of these things are reduced when you give physiological doses of bioidentical testosterone replacement. I'm not talking about super physiologic doses or people trying to, win bodybuilding championships. I'm talking about physiologic doses. Testosterone is really important for memory. Patients with Alzheimer's disease have been shown to have a lower ratio of total testosterone when compared with age-matched controls. So here, this was published in the Journal of Gerontology saying that low free testosterone is an independent risk factor for Alzheimer's disease. Wow. Okay, testosterone levels correlate with cognitive function. That's another one that was published. Here's another one. Low testosterone predicts insulin resistance and increases type 2 diabetes. There is a 1.6-fold increase in the risk of death in men with the lowest levels of endogenous testosterone. And guys, these are published in real journals. I mean, this is a Journal of Clinical Endocrinology. So this is important stuff. Okay, so testosterone replacement. For women, I love testosterone in women, but only in very, very, very small doses, and typically only topically for women. We use topical bioidentical testosterone from a compounding pharmacy, and that works really great for them. You could also use pellets, but I would never use it orally or inject it. For men, they can also start topically, but generally they feel best when they get into injecting it because they just need so much higher doses than women do. And also some women men really like pellets. And pellet is something that's inserted into your skin and lasts for 3 to 6 months. Estrogen. Okay, there's actually 3 types of estrogen. Estrone is E1, and this is the main form of estrogen that we make after menopause. E2 is estradiol, and this is kind of the one we think of in replacement and such. It helps against, hot flashes and those kinds of things. And then estriol is E3, and this is the primary form of estrogen during pregnancy. So estrogen is really important for bone health, brain health, heart health, and also is important for the central nervous system. They all kind of interplay, so this also affects cholesterol levels, blood sugar levels, bone and muscle mass, protects the cardiovascular system, stimulates collagen. This is a big one. You can even see people like in the aesthetic industry talking about this. They're even coming out, I saw recently, some topical estrogen because it is so important for collagen and elastin, the things that kind of help with the youthful appearance of our skin. Brain function, I see this in women going through menopause where they just feel like, I can't focus, I can't concentrate, they're kind of in a brain fog. It also helps to regulate mood. So if you're having low estrogen, which again, typically you're going to see this more postmenopausal, we all kind of think about the hot flashes, but sometimes pretty severe vaginal dryness to the point of pain and also increased vaginal infections and infections like UTIs. We can see this recurrently because of the low estrogen, kind of dry, crepey, sagging skin, mood changes, depression, tearfulness, weight gain, and difficulty sleeping. So here's kind of a, I put this here because when I was younger, of course, I thought menopause was just the butt of a joke, right? Like we all hear, you have hot flashes. But then when you really get into it, it's like, it's so much more than that. I mean, look at this. What organ systems are affected by estrogen? So symptoms of menopause: headaches, migraines, weight gain, night sweats, palpitations, breast pain, itchy, dry, tingling skin. I do see this. Stiffness, joint soreness, back pain, urinary symptoms, either incontinence or also increased UTIs, psychological stuff like interrupted sleep, severe anxiety, poor memory, inability to concentrate, depressed mood, irritability, mood swings, and some other stuff. So this is important. This is not something that we should just say, hey, it's menopause, get over it. It's like, no, this is really can significantly interfere with someone's life. And the opposite, when they get their hormones treated with bioidentical hormones, all of these things can be mitigated or resolved. So life-changing. So here's just some more data showing that, basically if you look at, we think of menopause roughly age 50, right? So on the graph, you see menopause and increasing heart disease. So the minute you hit menopause, your heart disease skyrockets. And a lot of it has to do with that dropping estrogen. These are lipid panel levels from like triglycerides and LDLs, and you can see from premenopausal levels in blue to postmenopausal levels, they're much, much higher. Here's just some, journal articles on menopause and bone and heart health. Looking at younger menopause age consistently associated with a higher risk of cardiovascular disease, osteoporosis, and fracture. So meaning the earlier you start menopause, which therefore the longer you're with those low estrogen levels, the more likely you are to end up with these high risks of cardiovascular disease, osteoporosis, and fracture. And by the way, when these women start having this heavy vaginal bleeding because of perimenopause and they just go and do a hysterectomy on them, you have now put them into menopause. And so you have taken these women in their 30s and just increased their risk of all of these diseases. It says these risks are particularly high among women encountering menopause at an early age due to a prolonged period of estrogen deprivation. And I have women come into my clinic who have had hysterectomies in their 30s and have not been on any hormones at all for 10 years before they came to see me. Sometimes something different but bad is also done, and I see sometimes people will be put on estrogen alone to counteract this, but then we know what happens when you have all that estrogen without progesterone or other things, right? So then they're basically in this massively estrogen dominant state for all these years, which also is not good. Here's another study this is from JAMA, about estrogen is protective against the development of cardiovascular disease in women. Studies of hormone replacement therapy in postmenopausal women show around a 50% reduction in risk of a coronary event in women using estrogen. So that's pretty massive, guys. If you look at the amount, cardiovascular disease is the #1 killer in America. If we could cut that in half by just giving estrogen, my goodness. Okay, so menopause and osteoporosis. We know that estrogen deficiency plays an important role in the pathogenesis of postmenopausal osteoporosis. and it is mainly a result of the recognition that estrogen regulates bone remodeling. So basically what it's saying is that estrogen is necessary for our bone health. And we also know that osteoporosis is very common, but also associated with very high morbidity, meaning that as people get old and they fall and they break hips and things like that, a lot of times that is kind of starts the kind of long downward trajectory for them. And so the high incidence rate of osteoporosis in women was mainly caused by the cease of estrogen secretion by ovaries after menopause. So essentially what they're saying is osteoporosis skyrockets after your estrogen drops with menopause. Okay, so estrogen replacement, I am a big fan of this, but again, it must be bioidentical. Typically, I like this topically for women. We tend to combine both E2 and E3 into a cream, and that's called Biased. I never recommend giving it orally because the way that it passes through the liver, you get really high conversion to E1, the estrone, and I kind of call that like the bad estrogen. And so you get really high levels of these E1 estrogens, which again is kind of increases that risk of breast cancer and uterine cancer and things like that, because estrogen is a proliferative hormone that will cause those tissues to grow, especially if unopposed with progesterone. So, benefits of bioidentical hormones: improved mood, improved sleep, improved energy, improved memory, decreased cardiovascular disease, decreased bone and muscle loss, decreased diabetes, decreased cancer risk. So, in short, bioidentical hormones might be the fountain of youth. And if any of those symptoms sound like you or sound like something you want to get, then I would definitely recommend that you talk with your provider, preferably a functional medicine provider, and talk about whether you might be a candidate for a bioidentical hormone replacement. Hey guys, just make sure you understand that this is not meant to be medical advice. This is purely an informational webinar for your learning pleasures, and I hope you enjoyed it. And here's how you can contact me if you have any questions or concerns. Okay, loved talking to you, and I'll talk to you soon. Bye.